I'm Dr. Beasley. I'm an obstetrician gynecologist or OBGYN. In addition to caring for women during their pregnancy and delivering babies, I also help women make decisions about their reproductive health and birth control options so that they don't get pregnant when they don't want to, and when they want to, they can. You have different options when it comes to birth control. Most methods work in one of three ways: a physical barrier, hormone-based, and non-hormone-based. Physical barrier methods can be permanent and last forever, or non-permanent. Condoms are the most common non-permanent physical barrier method, but diaphragms and cervical caps are in this category too. They work by physically preventing sperm from reaching the egg, so fertilization does not happen. You can think of this as using an umbrella in the rain. It is a physical barrier to keep you dry. It normally works really well to keep most of the water off of you, but it's far from 100%. Permanent methods work really well, and there are options for men and women. You may hear some people call these methods permanent sterilization, vasectomy in the case of men, or having your tubes tied. This can be a little confusing because as doctors, we are not actually tying the tubes. We either cut the tubes so that they are apart from each other or create some sort of barrier within the tube. Again, this is to prevent the sperm from reaching the egg. Hormone-based methods use man-made hormones or body signals that are very similar to the ones that you naturally produce. Each method works in many ways to decrease the chance of pregnancy. They may thicken cervical mucus to prevent the sperm from reaching the egg, prevent your ovary from releasing an egg, or make it harder for the sperm to reach the egg. I think of this like a security system. It doesn't just prevent an intruder from reaching the back door, it protects all of the other doors and windows too. This category includes methods like the birth control pill, the ring and the patch, the shot, and forgettable methods like the implant and IUD. All of these methods are much more effective than non-permanent physical ones. In addition to working really well, most all also have non-contraceptive benefits such as less pain and bleeding with your period and decreased acne. There are several non-hormone based methods, and they are all very different from each other. They tend to either make your sperm not work really well or help you and your partner figure out when you're most likely to get pregnant so you can avoid having sex during those times. The copper IUD is the most effective in this group, and as a bonus, it's also forgettable.